Good day. The soul of what America is all about is being interrogated today and over the next 2 months. We are approaching a once-in-a-lifetime opportunity and a historical corner that will determine if we as a society take that corner and finally enact an affordable, accessible, guaranteed quality healthcare plan for all Americans, or are we going to continue to drift along? My friends, it's battle time. I can't express enough the urgency that I'm asking you and your organization to get engaged. If your organization is not engaged, I'm asking one request from you today is to call an emergency staff meeting, call and get an emergency board of directors meeting of your organization and explain to them that the urgency that you need to move your organization into campaign mode to be able to mobilize your members, to let your members of Congress know that healthcare reform must happen. The Obama administration and Congress are clearing the legislative decks in Washington, D.C. The top priority for them in June and July is healthcare reform. The House of Representatives, 3 committees are going to be passing legislation, frankly, out of those committees in the next 2 to 3 weeks. And 2 Senate committees are going to be debating this and also be passing legislation before the July 4th recess. And then Congress is going to come back in July and they're going to be voting in the full House and the full Senate for legislation. So you can see on that timeline the urgency and the level of time that we have to be able to influence this debate is happening right now. You know, just to kind of stress the urgency, last Thursday over 225 people in LaGrange showed up to begin planning an expanded grassroots effort in Judy Biggard's district and in Daniel Lipinski's district to let them know that they better support healthcare for all. And just this past Saturday, 175 people showed up to a town hall meeting with Congressman Schock to let him know that if the healthcare that we as taxpayers give him, if it's good enough for him, it's good enough for all of us. Over the coming week, probably starting tomorrow, you're going to be getting daily emails from us, if not weekly emails for sure, asking you to contact your congressperson, contact your U.S. Senator. We're fortunate right now that both our U.S. Senators are on board, but we have to keep that pressure up on them. They know that they do support an affordable, accessible, guaranteed health care. We know that they also support the issue of a public health insurance option. But we need to let them know when they go back to Washington that pressure is continuously being put on them. Likewise, your member of Congress. I know my member of Congress. The likelihood of Congressman Johnson supporting health care reform is probably very minimal. But you know what? We're going to have to make him sweat. We're going to have to let him understand that small businesses, the faith community, organized labor, doctors and nurses, all are coming together to embrace this piece of legislation. And we're going to have to keep on calling him over and over again, even if he's not going to support the legislation at all. In addition, we're going to be initiating weekly conference calls that we hope you're part of, so we can at least let you know the latest information we're getting out of DC and what are those steps that we're going to be taking in the coming week. And lastly, as we expand our grassroots effort, we're also planning to implement a media campaign. And we're going to be needing your help to implement both our grassroots campaign and media campaign, $20, $50 to $100. You know, in our 20-year history of an organization, there are many times we come back and we ask requests from you. I can tell you that this is the biggest request and the most urgent request that we've ever had. You know, in less than 2 months, we will know if your health, your family's health, your community's health, that once and for all, we'll all have peace of mind, that we will know that when we need health care, it's going to be there. I know you're going to join with us. I know you're not going to allow the insurance industry to win this battle. And I thank you for your continued help and your support. Thank you very much.